pleurisy, the inflammation of the pleury of the lungs. Complications. Normally, the pleurisy disease appears after the age of 60 years when the immune system is weakened at this age and is more common in the persons who are chain smokers. Tobacco smoking is very injurious to the lung health because it consists of numerous hundreds of the chemicals which are very carcinogenic in human body, especially to the lungs and the urinary bladder. So, when the inflammatory process progresses, it produces respiratory distress, dyspnea, shortness of the breath, rapid and painful respiratory rate, and also there is tachycardia. The other diseases which contribute or the risk factor for this pleurisy, they are autoimmune diseases, rheumatic fever, rheumatoid arthritis, lupus, sickle cell anemia, and pulmonary embolism due to the heart disease. Because the circulation is obstructed by the thrombus formation in the vessels, and that produces infection and inflammation in the both layers of the pleury, and that causes the compression over the underlying lungs and reduces the vital function of the lungs, due to which there is shortness of the breath. Now, various complication appears, that is when the fluid in the pleural cavity between the two layers is excessive one, that is termed as pleural effusion. When it is blood tinted, there is bleeding, then it is termed as hemothorax. When air is also accumulated due to external injury and pores from outside traumatic injury or from the inner communication from the lungs, and that also is called as pneumothorax. All these complications, they produce compression force over the underlying lungs, and the respiratory system is diminished and disturbed, due to which there is oxygen diffusion is reduced. Subsequently, the oxygen supply to the various organs of the body, that is diminished. Now, there is a process by which we can visualize the interior of the pleural space, that is called as endoscopy, in which there is a video camera with light that is passed through the chest wall by a small incision under local anesthesia, and sometimes may perform under the general anesthesia in the older patient. The tool is passed in the pleural space and is visualized all the pathologies, especially TB accumulation, cancerous growth, bleeding, pus, fluid quantity, its nature, its location, all is visualized and estimated and can be observed by this process, the endoscopy. By means of this tool, we can also excise a small part of the pleury. It is termed as biopsy of the pleury and is sent to the laboratory for histological study to differentiate the various pathologies, whether it is TB, whether it is cancer, whether it is other types of tumors. So these are various processes which is performed in this disease.